When I began practice in 1999, we were all taught that pain was the fifth vital sign and that we should prescribe medications for pain no matter what, and that there was no limit to prescribing if the patient was in pain.
I started practicing at a time when they weren't used very much. I prescribed quite a bit.
I understood long-term opiates to be a standard care for chronic pain and to be using short-term opiates for breakthrough pain. And to increase the amount of opiates until a patient's pain was under control.
I was taking a short-acting oxycodone and a long-acting morphine sulfate, and I took also some muscle relaxers and anti-inflammatories and antidepressants, and all of that was for 10 years.
You get to a spot where you worry about the anxiety of, oh, where's my pills if I don't take my pills by this time? It's just a mess.
I was on 20 or so medications. When I was on all of them, I always had a sedation effect, and I didn't really want to do anything, and I was depressed all the time.
I didn't really have any affect at all, no personality traits. Very depressed, so that was a big component of creating more pain. And emotionally, I just was a wreck.
I think every physician here probably had patients who died.
I know that there were a number of people who would have done better if I'd prescribed differently to them.
People ended up becoming addicted, having lots of side effects, and we're in a big mess because of that. We now, as a society, need to go back to realizing that there are lots of different types of modalities that need to get involved in the treatment of chronic pain.
In 2013, our clinic became involved with the OPG project. We started focusing more on patient function, patient risk, other risks associated with the opiate medications. We started doing more screening for mental health conditions and trauma and anxiety and PTSD. And it's amazing once you start asking those questions, what things you uncover.
The Wellness Coach Project started when I was seeing a lot of patients here at the West Medford Health Center who needed a lot more than just a doctor to support their health care. So I talked to a number of my team and discovered that our integrated behavioral health coaches might be able to help me more than they had in the past.
One of the things that I noticed as I started working with the patients that Dan referred to me was that many of them had chronic pain. Many of them had severe complex trauma histories.
Dan wants to know what is going on with my body and what I feel in my body. Heather wants to know what is going on in my brain and how we can apply that to my body.
What has really helped me is my medical team. I'm actually glad that I'm part of the program because I don't think I would be where I am today without it.
After working together for almost a year, Wendy and I came to the understanding that a number of her medications were not necessary for her organ function or for her life, and that she had the power to control many of her symptoms.
I hurt all the time, but I use distraction to get away from it, to get away from the pain.
A lot of what we're doing is helping the patient find their own center of strength. And as they become familiar with their own center of strength, they start to notice their own solutions and their own alternatives.
As I slowly got off of all these medications, I noticed that my energy was coming back and I wasn't sedated, so I had more energy to do things, to get out and go out and go walking. I actually collect heart rocks. I also collect other rocks like crystals, like tiger's eye or amethyst or rose quartz. I find it has a healing factor.
Now that I'm off the pain medication, I manage my pain by doing mindfulness. I also use some relaxation techniques and stretching techniques. And I use peer support. That has been very, very helpful, knowing that I'm not alone in this journey. Chronic pain is very isolating.
If you're gonna get better, you have to look for down the road, not just day-to-day life.
providers need to, quote unquote, force their patients to participate in non-opioid treatment modalities.
As physicians and practitioners, as we learn that there's lots of other things besides medication and opiate medications that are effective for pain, I think we have to really empower our patients to seek out those other options.
We're never too old to learn new tricks, and at any age, somebody who feels like they've been living with chronic pain, doesn't know what to do to manage their pain without opioids, I think could definitely benefit from behavioral approaches. And sometimes we get so deconditioned protecting our body because we're afraid it's going to hurt that we need skilled individuals to help us start to move again.
There's things that we do every day that we don't think about. They are things that we learn how to walk, and we walk a certain way since we're age 3. Those things we haven't looked at is a pattern. And looking at those patterns is the way we stand up from a chair, the way we sit, the way we walk, the way we pick up an object. Taking a look at that and see, are they really helping me? Can I change one thing, and that one thing can maybe bring more healing, less discomfort? So it's slowing down enough to pay attention to the habitual things that we do, and then start making changes to it and see what happens.
What I've noticed from being in the room with providers when they're having the conversation with the patient about the fact that these medications are no longer as safe or effective as we were once led to believe, is that in that moment, what happens is the patient often freaks out. And what's happening for them is that they are reacting to this idea of the Band-Aid getting ripped off of their pain. And for the providers, if they can, in that moment, reframe that patient's behavior and understand that that's a survival skill and that the patient is likely to do anything, sob, scream, threaten, be hostile, that in that moment, if the provider can stay calm and can stay connected and can believe in their patient's ability to make the change and to have confidence in themselves in working with this patient through this taper, that goes a long way. And that for these patients at that time, that they don't have that belief. And that for the providers to be able to hold the belief for the patient, to hold the confidence for the patient, that they'll get there eventually. But in that moment, they're freaking out because the Band-Aid is getting ripped off of their pain.
We are all in this together. Even though you might feel you want to hide from the world, go and reach out for people who are really together in this. I know it works when we are in a group setting. We have compassion for each other. We communicate and share things. And just the fact that you are in a group, that you belong, that you're not alone, it's healing by itself. I can assure you it works.
I'm not fighting it. I'm not constantly in this inner struggle with my pain. It just comes along with me and it's there and I realize it and I can look at it in a much different way than I ever did before.